I am Priyanjali from Radiance with You YouTube channel. I'm sure all of you must be keeping good health. Today, we are talking about something that affects everyone, no matter where you live: fungal infections. We are going to have an important chat about them and how we can stop them from spreading by taking actions early. Fungal infections like athlete's foot or nail fungus might not be the first thing we think about when it comes to health, but they are important and can cause serious problem if we ignore them. They can make us really sick if we don't deal with them properly. But don't worry, we are not just here to talk about the problem. We are here to talk about what we can do about it. We'll look at how to stop fungal infections from happening and talk about the latest treatments. This month is all about being aware of fungal infections and how to stay healthy. So let's connect today with our skin expert, Dr. Jatin Sharma, live from Chandigarh, to talk prevention methods to combat fungal infections. Dr. Jatin Sharma is a consultant dermatologist, venerologist, leprology, and holds fellowship dermatosurgery currently based at Chandigarh. He has done his MBBS, MD in dermatology, venerology, and leprosy from Indira Gandhi Medical College, Shimla, fellowship in dermatosurgery from VMMC and Safdarjung Hospital, New Delhi. He is truly a patient focused dermatologist and experienced in skin health and in providing preventive skincare to adult and children. Adept at diagnosing and treating diseases of human skin, superb interpersonal skills with profound communication and research abilities. Talented at developing effective treatment plans for various skin conditions. He is presently working as a dermatologist at Astra Skin World, Zenatpur, and Fortis Hospital, Mohali. Welcome, Doctor, to today's platform. We are extremely delighted to have you here today. Doctor, the first question for you would be: what are the most prevalent fungal infections in our region, and which prevention strategies do we recommend for each?
Yeah, hi everyone, and thank you so much for inviting me for this talk because this is a very, very important talk. As we know that fungal infections are very, very common conditions, which generally a lot of people suffers from it, and generally, especially in summers during which it affects the most. So, if we talk about the fungal infections, so fungal infections को लेके बहुत सारी myths हैं जिसको लेके I wanted to just come out with some new tips for you. सबसे पहले हम बात करेंगे like which fungal infections are common. So if we talk about from head to toe, it can affect your hairs, it can affect your skin, or it can affect your nails also, right? So if I respecting your hairs, so one type of a fungal infection which we call a simple dandruff, which is again is a fungal infection. So you should get yourself treated for your dandruff. If you feel any dandruff on your scalp, you should get it treated with your dermatologist. Then comes to the skin part, because skin part is a very, very important part and it affects very, very commonly in our patients. So फंगल इन्फेक्शन में सबसे पहले जो इफेक्ट आता है वो आता है एक सिंपल टीनिया टीनिया वी कॉल इट टीनिया क्रूरिस और टीनिया corporis and tinea cruris जो जिसको हम jock itch भी बोलते हैं. This is very, very common in our patients, in people during summer months. उसमें आपने देखा होगा जो हमारे ग्रॉइन एरियाज में हैं, ग्रॉइन एरियाज के ऊपर एक तरह की रिंग्स फॉर्म होना शुरू हो जाते हैं जिसको हम रिंग वॉर्म बोलते हैं. सो दिस इज वन ऑफ द टाइप ऑफ अ फंगल इन्फेक्शन व्हिच इज वेरी, वेरी कॉमन इन एडल्ट्स during these months, and even can affect the children also, right? The same thing can happen on the body area, which in the form of ring, which act as a ringworm infection, which जिसको हम एक ringworm infection की तरह बोलते हैं, but it's a fungal infection, it's a tinea infection. So these are the form which can affect our skin, and it is totally treatable form. But again, you need to go to your dermatologist. You need to take a proper treatment for that, right? Then comes the nail part. Nail, even the fungus can affect the nails also. And nails में हम इसको बोलते हैं onychomycosis or tinea unguam, which can affect your nails. And the nails can be of hand nails. It can be your foot nails also. Okay. So उसमें भी अगर fungal infection हो जाता है तो उसकी वजह से भी जो नेल्स हैं वो हमेशा के लिए डिस्टॉर्ट हो जाते हैं, एंड यू कैन हैव अ बैड नेल्स, थिक नेल्स, एंड इवन द परमानेंट डिसफिगरमेंट ऑफ द नेल आल्सो. सो दीज आर द टाइप ऑफ फंगल इन्फेक्शंस which can affect your body, and you should get itself this for treated well in time with your dermatologist, right?
Right,
Yes.
right. डॉक्टर, अक्सर जो प्रॉब्लम होता है इज आइडेंटिफाइंग द इशू. तो साधारण तौर पर इनिशियल स्टेज में कैसा दिखता है, ये कैसे लोगों को पता चले कि ये फंगल इन्फेक्शन है?
Yes. So this is a very important question because हमें शुरू में पता ही नहीं लगता कि what is happening. So
Right.
what you need to do is whenever you feel any itchy area, especially in the folds, right? Folds like
Mhm.
underarm, right? Then groin area, you know, uh, you should check for it. And if you feel any rash in that area, आपको लगता है कि redness आ रहा है, rash हो रहा है, you should get yourself checked. Don't start using your self medications because that self medications can be very bad
Right.
in that case. Or initially redness will be there, rash will be there, even the scaling like your skin is coming out from that area. So that if you feel any scaling, redness, ring like lesions, like ring like no spots on your body, get yourself checked with a dermatologist. Don't do the self medication. This is again very very important. I want you to especially precisely want to discuss this through this platform, that don't get yourself treated with the self medications like from chemist
Right.
shop or something like that, right?
Right.
So any
Right.
rash, any itchy rash, any redness, any spots you are seeing on your body, get yourself tested for.
सो
Yes.
डॉक्टर, ये जिस रेडनेस के बारे में हम बात कर रहे हैं, स्पॉट्स के बारे में हम बात कर रहे हैं, ये क्या किसी चीजों के एप्लीकेशंस की वजह से हो सकता है? द इनिशियल स्टेज,
Yes.
कैन इट ऑकर बिकॉज ऑफ एनी ओवर द काउंटर मेडिकेशंस और एनी एप्लीकेशन ऑफ एनीथिंग?
Yes. So as I told you, the first symptom of fungal infection is rash, itching, right? But ये किसी भी चीज से होता है, right? आजकल क्या हो रहा है, जैसे बहुत ज्यादा sweating होता है, तो even the sweat can cause that redness or itchiness in the body, right?
राइट.
So
राइट.
it is not like you're feeling any redness or itching on the body, and it is directly you start antifungals and these are a fungal infection. No, it is not like that. So redness on the body, rash on the body, right? Or itching on the body can be a symptom of simple heat, है ना? Simple heat, sweating, or this no this type of a problems. So again, as I told you, if you feel any itchy, redness, or कुछ भी आपके body पे आता है, you should get yourself checked with the dermatologist before it gets worse. And simply what you can do, you can start using your, if you can apply some talcum powder. If not going with the talcum powder, it is better to apply a simple talcum powder rather than to apply any medications, over the counter medication. And if it is
राइट.
not getting cured, then you should get treat self you get tested for go to a dermatologist for this.
Right, right. Doctor, will quickly move on to the next question. The next question is, are there any specific population that are more susceptible to fungal infections? And if so, what preventive measures should they take?
Yes. So if I talk about the population, like we are living in North Indian state. So North India is very very humid nowadays, and even the South India is very humid as compared to North India.
Right.
So the fungus, it tends to grow most in a hot and humid environment, right? Where there is a temperature is more and the humidity is more. It tends to grow in these areas. Though it tends to dull on the skin very commonly in these areas. Okay, but it can affect any age group, right? It can affect from a children to a old age person also. There is no age group specific for the fungal infections. And the specific age group, like which are working, which are sitting for a longer period of time, somebody is on the computers, and like our lifestyle is like that people are now working in a IT sector, and वो पूरा दिन बैठे रहते हैं, उनका कोई मूवमेंट बहुत ज्यादा नहीं होती है. So any areas which are sitting for a longer period of time, you tend to sweat in that area. And sweating, as I told you, hot environment, sweating, and prolonged sitting, that can further aggravate the problem, right? But if you ask me any particular age group, if you ask me any particular set of people, no, it can affect anyone. From the lower socioeconomic strata to a higher socioeconomic strata, anyone can be affected with this problem. So fungal infections is quite prevalent in every age group and every people nowadays, especially in summer months.
राइट. राइट. डेफिनेटली समर्स की बारे में बात करें तो समय के साथ आई थिंक हर जगह थोड़ा सा गर्मी ज्यादा बढ़ गया है
Right.
बिकॉज ऑफ ग्लोबल वार्मिंग और व्हाट्सोएवर रीजन इट इज. तो प्रिकॉशंस थोड़ा सा हमें आई थिंक समय के साथ थोड़ा ज्यादा अपनाना चाहिए. डॉक्टर, विल क्विकली मूव ऑन टू द नेक्स्ट क्वेश्चन. द नेक्स्ट क्वेश्चन इज, what role does personal hygiene play in preventing fungal infections? And are there any specific hygiene practices you recommend?
Yes. So this is very important. Personal hygiene is very, very important, as I told you, because again, the hot and humid environment, which can aggravate the problem. So you need to take baths daily. You should bathe daily. आपको रोज नहाना चाहिए, है ना? And with the proper soap. And the soap should not be very harsh. Like people try to use, scented soaps and different type of soap. But I think a simple soap which has a which has a very not very which is not causing your skin very dry. So you should take a normal bath daily. Once in a day is more than enough. You should not take bath twice a day or thrice a day. Once a day bath is more than enough. You should clean your areas very properly, like your folds and your underarm, as I told you. And then after
Mm.
that, you should apply some kind of a moisturizer on your body. This is very important because, as I told you, when you take a lot of people, what people do in summer, like they take bath two or twice or thrice a day. That disrupt your skin barrier, and that skin barrier is one of the very important factor which prevent fungal infections. तो अगर बहुत ज्यादा आप नहाते हो, बहुत ज्यादा सोप्स बार बार लगा रहे हो, that that can disrupt your skin barrier, and your fungus will over cleaning again is not very good. So at least once in a day is very good. You should take a once in a day bath, and alongside you should apply some moisturizer on your body. And most importantly, you should not share clothes with another, with one another. Sharing of clothes are very bad actually, because fungus tends to spread by sharing of clothes. So this is a very, very important point for the people who are living in hostels, who are living in a PGs, like you are sharing your beds and you are sharing your clothes with your friends. You should not do that, right? Your undergarments, your towels, your clothes, your bedding should not be shared. Okay, try not to share, because that can spread the fungal infection. We generally say to our patient, whenever our patient comes to us, even in the family, the one patient can spread from one to another. Okay, so if one patient of one person in the family is having the problem, you should not share the clothes with another family. Even we say that you should not wash your clothes all together in a same washing machine or just like that. So because it is a communicable infection and it can communicate very, very fast, right? So sharing of
Right.
clothes, personal hygiene, once in a day bath, and application of a proper moisturizer on the body is a key to prevent from the infection, from the fungal infection, right?
Right, right. So, doctor, we come to a conclusion, which is just maintaining your personal hygiene is not important, but your surrounding, the people
Yes.
you are staying with, you also need to take care of that कि आपके आसपास कैसे लोग हैं, आपके आसपास लोगों को फंगल इन्फेक्शन है कि नहीं, you need to be aware of that,
Yes.
और उसी हिसाब से आप डील करें. Well, doctor, will quickly move on to the next question, which is, are there any dietary or lifestyle habits that can help boost the immune system and reduce the likelihood of fungal infections?
Yes. So as I told you, basically it's an infection. So, and we know that every infection can spread if we don't have any, if we're not eating our food properly, and if our immunity is not good. Okay. So हमें अपनी immunity को normal रखना है, और उसको रखने के लिए what we can do is we should have a proper meals, we should have a proper diet. Okay, it should be a balanced diet, right? You should avoid junk food, because junk food is not going to give you anything. Okay, you should have a proper 3 time meals आपको लेना चाहिए, and वो भी जो घर का खाना, and उसमें सब कुछ balanced diet means you should have seasonal fruits, seasonal vegetables, right? And plenty of fluids, everything has to be there. So you need to keep your immunity high. And how you can do that? With the diet and with your day-to-day activities. Like you should sleep at on time, you should wake up on time, right? And then you should take proper meals in time. And then stress is a very important factor for any for immunity. So you should be stress free all the time, and try to be not to take stress so much, because nowadays stress is very, very common in every human being. So but you should आपको इस चीज से दूर रहना चाहिए. एंड देन जितनी भी चीजें आपकी इम्यूनिटी को बूस्ट करेंगी, उतने आपको इन चीजों से, फंगल इन्फेक्शंस हैं, चाहे बैक्टीरियल इन्फेक्शंस हैं, चाहे वायरल इन्फेक्शंस हैं, आपको उससे प्रिवेंशन मिलेगा. दूसरा, आपकी जो डाइट्स हैं, डाइट में तो मैंने यही बोलना चाहूंगा कि इम्यूनिटी इज इंपॉर्टेंट. यू शुड टेक एवरीथिंग. देयर इज नो प्रॉपर पर्टिकुलर डाइट व्हिच कैन प्रिवेंट फंगल इन्फेक्शन. So you should have a balanced diet, you should have a proper meals, and you should keep your immunity sound. That is the ultimate mantra to stay away from fungal infections.
Right, right. Doctor, the next question is, what preventive measures can healthcare professionals take to minimize the risk of nosocomial fungal infections in healthcare settings?
Yes, so healthcare settings में मैं अगर nosocomial की बात करूंगा, तो I'll talk about the bigger setups where the hospitals are there. So because as we share the linen, some share karte hain, yeah, we share the clothes also, so that has to be discouraged, because it has to be properly sanitized. So अगर वो sanitation properly maintain की जाएगी तो वो उसके chances कम रहेंगे. But we have seen people suffering from the fungal infections, and it spread very fast in hospital setup also. So the ultimate thing is not to share the things, and if we are sharing the things, it has to be properly sanitized, अच्छे से sanitize हो, so that कि उसके जो fungus के spores है, because fungus infection के जो spores होते हैं, they can stay on the on the clothes a longer period of time. So उससे हमें बचना पड़ेगा. Even if we can sanitize with the disinfectants also, that will be very good. जो हमें clothes हैं और linens हैं जो कि hospital setup में use करते हैं. So ultimately, we should discourage the use of the sharing practices in hospital setup also, and proper sanitization of the clothes is very, very important. But one more thing I want to add here is, as I told you, what the people coming to us nowadays is a self medication. Again, self medication has become very, very bad in fungal infections. What people are doing, they are applying steroid medications or over the counter medications on fungal infection, which is spreading very fast. It has become very, very difficult for dermatologists also to treat fungal infections. Why it is happening? Because people are using steroid medications, people are using OTC medications, and the fungus is becoming resistant to treatment, right? That resistance has become very, very bad, and this resistance has become very, very common in hospital setups also, right? So we have to prevent this, and through this media, what we are talking today, I want everyone, you should not self-medicate yourself with the over-the-counter medications. Always seek your dermatologist before applying any medication on this problem,
Right.
right?
Well,
Yeah.
doctor today is again and again mentioning the same thing. Well, बहुत सीरियस बात है कि आप प्लीज खुद की जांच खुद ना करें. हमारे एक्सपर्ट्स हमेशा मौजूद है आपकी सहायता करने के लिए, टू गिव यू द बेस्ट सोल्यूशन पॉसिबल. सो डू नॉट वेस्ट टाइम इन सेल्फ मेडिकेशन. आप समय भी वेस्ट कर रहे हैं, आप अपने पैसे भी वेस्ट कर रहे हैं, और आप अपने शरीर को भी एक बहुत ही गलत पोजीशन में रख रहे हैं. You're risking your health also. So please do not do that. Visit the expert. Doctor, we'll quickly move on to the next question, which is, are there any advancements in preventive therapies or vaccines for common fungal infections that individuals should be aware of?
So there are currently no vaccines for prevention of fungal infection. Maybe in future it is going to come into the market. But preventions are like that. As I told you initially, that most important is your personal hygiene. This is very, very important. Second is don't share your clothes. Again, as I told you, clothes sharing is very, very common, especially in hostel setups and in our PG setups. You should not do that, right? And the third thing is that is very, very important is in prevention, that you should not you should not play with your immunity, because as I told you, the nowadays the lifestyle is very, very bad. People are not taking a proper sleep. Stress pattern has become very bad, very, very bad nowadays. So your personal immunity will is very, very important in controlling all fungal infections, right? So if your immunity is very good, then you can prevent this. The only thing, because as I told you, there are no vaccines for fungal infection. Only you can prevent your fungal infections by educating yourself, है ना? by these talks what we are talking today, right? And not to do a self medication. This is very, very important. Whenever you feel any itchy spot, whenever you feel any itchy area, any rash on your body, get yourself tested, get yourself checked as soon as possible. So the prevention, that is the problem with the fungal infection, because as I told you, there is no vaccines, there is no any preventive medication for this. The only thing is your personal hygiene, your immunity, your food, your lifestyle, your food habits. Okay, anything which decreases your immunity, like alcohol intake, smoking, this all can decrease your immunity. So you will be more prone for all these fungal infections. So these are things which you can prevent, which uh, you can apply in your lifestyle to prevent all these fungal infections in your lifetime, right?
Right. Well, आज हम बहुत ही बेसिक बातों के बारे में बात कर रहे हैं, पर अगर आप देखेंगे तो यही बेसिक चीज सिर्फ फंगल इन्फेक्शन से नहीं बल्कि बहुत सारी बीमारियों से आपको बचा सकती है। हैविंग अ गुड लाइफस्टाइल, हैविंग अ गुड इम्यूनिटी कैन सेव यू फ्रॉम अ लॉट ऑफ प्रॉब्लम्स व्हिच यू आर फेसिंग टुडे। सो आज हम बेसिक बात करेंगे और आज हम बहुत ही इंपॉर्टेंट बातें कर रहे हैं। वी हैव डॉक्टर विद अस टुडे। Doctor, can you please provide us recommendations on the appropriate use of antifungal medications as preventive measures, including potential risk and benefits?
Yes. So, सबसे पहले ट्रीटमेंट से पहले मैं बात करना चाहूंगा. There are few diseases also which can which can show like a fungal infection in a patient. Like, right, if someone is having a recurrent fungal infection, like किसी को अगर बार-बार से infection हो रहा है, so then it can be it can keep pointing towards something in interior disease which is happening inside you, right? So
Right.
if someone is having diabetes, okay, so diabetes can present like a recurrent fungal infection also, right? If someone is having a recurrent fungal infection, maybe of a groin area, maybe of the body, maybe of the private part also. If you're feeling a recurrent fungal infection, then it can point towards the diabetes also. Diabetes like sugar levels. You have to get yourself checked for the sugar levels. Okay. So this can be one of the pointer of the sugar, increased blood sugar levels in your body, right? And another thing, if you're having a similar type of fungal infections happening again and again and again, that means your something's abnormal things are happening inside your body. Again, as I told you, this is very, very important that you should get yourself checked with a dermatologist, because at that point of time, you can check out whether you are having some internal disease also, because this can be fungal infection is can one of the pointer of the internal diseases. Okay, so this is very, very important. Coming on to the question that what are the treatment recommendations? So there are multiple treatment protocols uh, for fungal infections, and I'm not going to discuss that what you should take on the YouTube, but yes, there are a few medications which you can try and which you can apply. And firstly, most important is what you should not apply. That is steroids. Any
Right.
creams which contain steroids, you should not apply that. Okay, because as I told you, whenever you apply any steroid cream, you will see the improvement. And initially, definitely improvement will be there in the symptoms, right? You will see the decrease in the redness, you will see the decrease in the itching part, and you thought like, yes, I'm getting treated with this. Okay. But after some time, it will, blast like, like a bomb, and it will spread on whole body, because steroid act as a food, steroid act as a food to fungus. Okay. Fungus tend to grow more on steroids. So generally, if you go to a simple chemist shop, or if you're going to a any doctor which is not a dermatologist and doesn't know the effect, the what is fungal and what is this, so it's definitely going to give you 99% people, they give you a steroid creams, and these steroid creams is going to make the thing worse. And as I told you, what steroid can do is, it can once it will spread your infection, and then second, what we can do, it can cause the fungus to become resistant. So the treatment which we generally give, it will not our treatment will not work on that fungus. Okay. So first of thing, you should not apply the steroids cream. Whenever somebody is going to a dermatologist, you should ask your uh, to a chemist shop, you should ask if you're not giving any steroids. Okay. So you should not apply any steroid cream on the fungal infections. Okay. First of all, what you can do, you can simply apply any antifungal which available over the counter also. Simple plain antifungals you can try. Okay. But again, as I told you, because you need to go to an expert for that, there are certain tablets, there are certain capsules. Okay. There are certain creams, there are certain lotions which you can apply, which prescribed by a dermatologist. And believe me, the fungal infection is 101% treatable condition. Okay. I have seen people myself, people are suffering from fungal infection for the last 2 years, 3 years, or 5 years also. They are not getting they are not getting cured. It's all because of the self medication, nothing else, right?
Right. Right.
So
Right.
so the thing is, if you're if you are going to a dermatologist in a proper period of time, अगर आप time से जा रहे हो, so this is a properly 101% properly treatable condition. And once you get treated, you will not get it again. That is for sure. Okay. It is not a recurrent. It's not a recurrent disease. Okay. But yes, you need
Right.
to follow certain protocols. You need to follow
Mm-hmm.
certain, like, as I told you, personal hygiene, certain do's and don'ts you need to follow in fungal infections. You will not get it again. But yes, there are proper treatment protocols for that with the dermatologist. This is very important, right?
Right. राइट। वेल, बड़ा ही सिंपल बात है। आपको ज्यादा कुछ नहीं करना है, बस अपने एक्सपर्ट्स की सुननी है। दैट्स ऑल यू हैव टू डू। आपको ज्यादा नहीं सोचना। अ, एक जन है डेडिकेटेड इंसान जो आपको हमेशा अच्छे तरफ गाइड करेंगे। यू जस्ट हैव टू लिसन टू द पर्सन, दैट्स इट। वेल, डॉक्टर, टॉकिंग अबाउट एंटीबायोटिक, is a long term antibiotic somehow harmful for patients? हमने सुना है ऐसा. So would you like to clear the myth today?
Yes, yes. Even the long-term antibiotics can further predispose you towards fungal infections, right?
Hmm,
जो
hmm,
लोग
hmm.
बहुत ज्यादा एंटीबायोटिक्स लेते हैं, as I told, antibiotics is very very bad for, you know, self medication of self antibiotic are very bad. So
Right,
antibiotic again you have to take with the prescription of a doctor only, you know, medical practitioner, not like that. But if someone is on prolonged period of time, अगर कोई बहुत टाइम से एंटीबायोटिक्स ले रहा है, then he will be prone for a fungal infections because हमारे हमारे बॉडी में कुछ एक बैक्टीरियाज होते हैं जो कि जो कि गुड बैक्टीरियाज हैं, ओके, जो हमारी बॉडी पे रहते हैं, ओके। सो जब तक वो रहते हैं तो हम एक हमारी स्किन का एक एक बैरियर मेंटेन रहता है और वो इन्फेक्शंस नहीं होने देता, लाइक फंगल इन्फेक्शन को आने नहीं देता, इवन द बैड बैक्टीरिया कैन नॉट कम, ओके। बट व्हेन यू टेक ओरल एंटीबायोटिक और वेदर टॉपिकल एंटीबायोटिक्स आप बहुत ज्यादा यूज कर रहे हो, तो देन वो जो एक बैरियर सिस्टम है स्किन का वो भी डिसरप्ट हो जाता है, ओके। जब वो
right,
डिसरप्ट हो जाता है तो देन आपकी जो फंगल इन्फेक्शंस हैं, जो आपके बैक्टीरियल इन्फेक्शंस, दे टेंड्स टू पेनिट्रेट इन योर स्किन एंड देन कॉज फंगल इन्फेक्शंस, राइट। तो ये देखा गया है कि जो लोग बहुत ज्यादा एंटीबायोटिक लेते हैं उनमें ओरल कैंडिडियासिस करके एक बीमारी होती है जिसमें मुंह के अंदर फंगल इन्फेक्शन हो जाता है, मुंह लाइक टंग रेड हो जाती है, आपका ओरल मिकोजा, मुंह के अंदर रेडनेस आना शुरू हो जाती है, ओके। तो ओरल कैंडिडियासिस इज वेरी वेरी कॉमन इन पर्सन हु आर टेकिंग लॉट ऑफ एंटीबायोटिक्स। इवन इवन द कैंडिडियल वेजिनाइटिस हम जिसको बोलते हैं, जो कि प्राइवेट पार्ट में फीमेल्स के जो प्राइवेट पार्ट में इन्फेक्शन हो जाते हैं, दैट्स अगेन बिकॉज ऑफ द prolonged use of antibiotics. So antibiotic, OTC antibiotic use karna without the prescriptions of a doctor is again bad. You should not take that. So again, self medication here I comes again is a bad for skin. All right.
राइट। डॉक्टर, आपने कहा वजाइनल फंगल इन्फेक्शन एक बहुत ही लाइक रेजिंग टॉपिक है आज के डेट में। अक्सर विमेन सफर कर रहे हैं। वी सी एवरी नाउ एंड देन विमेन सफरिंग, एंड दे आर नॉट एबल टू फाइंड द राइट सोल्यूशन। मे बी उनको अच्छा गाइडेंस नहीं मिल रहा है, मे बी उन्हें नहीं पता है कि किसके पास जाना है एग्जैक्टली। सो व्हाट इज द इनिशियल स्टेज लुक लाइक? क्योरेबल है? और रीजन क्या है इसके ऑकरेंस का? कैसे हो सकता है? पब्लिक टॉयलेट्स की वजह से, मेडिकेशन की वजह से, या स्प्रेड की वजह से? व्हाट कैन बी द रीजन? कारण क्या है?
See, public toilets is a very, very important source of these infections, basically, because now we go to a mall and we use the public toilets. So that can be one of the reason for, you know, recurrent fungal infections on these areas. और वो बहुत ज्यादा
राइट,
कॉमन हो सकता है। उसमें इनिशियल सिम्टम भी यही रहता है कि आपको यूरिन में जलन होएगा और ये सब चीजें, रेडनेस आ जाएगी, इचिंग इज वेरी कॉमन इन द प्राइवेट पार्ट एरिया, इन स्पेशली इन फीमेल्स, राइट। सो
राइट, राइट,
so use of public toilet has become very 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 common nowadays, and उसी के बाद ये ज्यादा प्रॉब्लम शुरू हुई हैं। दूसरा
राइट,
एंटीबायोटिक का, जैसे मैंने डिस्कस ऑलरेडी किया है कि बहुत ज्यादा जो लोग एंटीबायोटिक ले रहे हैं किसी और प्रॉब्लम्स के लिए, उसमें भी ये वेजिनाइटिस और ये यूटीआईज, दे हैव बिकम वेरी वेरी कॉमन नाउडेज, राइट। एंड देन आपका जो इवन इवन जो ओवर हाइजीन इज अगेन, I'll say that over hygiene is very very bad. Over cleaning of the private part in females has
राइट,
become very very common. Again, as I told you initially कि वहाँ पे जो good bacteria हो जाते हैं, अगर आप बहुत ज्यादा over cleaning कर रहे हो, तो that good bacteria जिसको हम lactobacillus बोलते हैं in females, right? So that lactobacillus will go away and the bad bacteria tends to override on the skin. Okay, so that is again becomes a very very common phenomena. तो females में again मैं यही बोलूंगा, don't over clean the area, है ना, right? People are using multiple things nowadays to clean. Over cleaning is bad. And public toilet जब भी यूज करना है, you should spray. आजकल disinfectant sprays आ जाती है, you can spray something on that area and then you should go to a toilets in this, because females में urethra का जो साइज होता है बहुत छोटा होता है, you know. So females में कंट्रैक्ट जो आपका यूटीआई के चांसेस हैं बहुत कॉमन है इन पब्लिक टॉयलेट एज
राइट,
कम्पेयर टू मेल्स, राइट।
राइट,
सो
राइट,
फीमेल्स में ये बहुत इंपॉर्टेंट है, यू शुड क्लीन द एरिया बिफोर सिटिंग इन दैट एरिया एंड देन you should, whenever you go to a washroom, you should clean it with a proper toilet paper and just throw it there. Don't over clean it. Over clean करेंगे, that's again not very good. And OTC medications, again, you should not take all OTC medications. खुद कुछ ना लगाएं. If you feel any problem in that area, should consult your dermatologist as soon as possible. That is important.
So
Right?
डॉक्टर लो इम्यूनिटी भी कारण हो सकती है इसकी?
Yes, low immunity is very, very, as I initially I'm told, because it is infection. Fungal, it is whether it is a bacterial infection, but is it a fungal infection, but is a viral infection. Every infection, the immunity counts, right? So if you have a
Right.
low immunity can be because of, as I told you, number of factors are there. Your poor sleep, your stress, your eating habits, your drinking habits, smoking. These all are things which decreases your immunity. And if your immunity is not good, you will be more prone for fungal infections, more prone for your viral infections, right? And bacterial infections. So immunity plays a very, very important role in this.
Right, right. So now, Doctor, we'll quickly move on to the questions which we are getting for our viewers today. The first question comes from Meenal, who asks, what initiatives can be undertaken to address the environmental factors contributing the emergence and spread of drug resistance fungal pathogens?
See, drug resistant pathogens or fungal infections, it has become very, very common. Why it has become common? As I told you, the number one is use of self medication, right? So, use of steroids, OTC medications. But people are doing, they are taking a short course of fungal infection, right? Doctors saying them to start your medication and complete your course in 3 weeks. But what people are doing is they are taking just 7 days course. Within 10 days, they are free of their symptoms. They are just stopping all the medications, right? So the fungus tends to become more resistant. Okay, so you should complete your course as the doctors has prescribed, and then doctor calls you for a follow up also, right? 3 हफ्ते की मेडिसिन आपको दी गई है. You should come back again to a doctor and he'll show it again, because लोगों को लगता है कि 3 हफ्ते की मेडिसिन है उसके बाद खत्म, डॉक्टर के पास नहीं जाना है. So it is not like that,
Right.
right? You should visit a doctor, because by seeing the patient, doctor can tell you whether you need more medications or not, right? Symptomatically you will be better, but no, clinically you need to go to a doctor, right? So you need to complete your course, you need to complete your topical, your oral medications, and then see your doctor again, right? This is very important. Don't use OTC medications. आपने use नहीं करना. So these are 2 things which you need to follow in your day-to-day life, right?
Right. Dr. Meenal एक और सवाल पूछती है. She asks, are there any natural or over-the-counter remedies that patients can use to prevent the symptoms of fungal infections, and what precautions should they consider?
See, frankly, as I told you, if day to day, I want you to take a proper bath, ठीक है? आप
Mhm.
proper daily once a day या twice a day भी ले सकते हैं, and then moisturize your skin, maintain your skin barrier as much as possible. Moisturization is very, very important. And then simply, if you see any rash on your body, you can simply apply a calamine lotion. Calamine lotion is the रेमेडी विच यू कैन, जो घर में मिल जाती है किसी के भी, यू कैन सिंपली अप्लाई कैलमे लोशन. इफ यू गेट, अगर आपको लगता है उससे फर्क पड़ रहा है, वेल एंड गुड. नहीं पड़ रहा है, डोंट अप्लाई एनीथिंग एल्स. ओके, स्ट्रेट अवे गो टू अ डर्मेटोलॉजिस्ट. ओके, बिकॉज as I told you, whenever you go to a chemist shop, he definitely going to give you a steroid cream, and there the problem starts. Okay, so simple, a daily bath, keep yourself dry. Folds को आप ड्राई रखें, उसको बहुत ज्यादा वेट ना होने दें. ओके, and calamine lotion. That is more than enough initially at home. That is more than enough. Okay.
Right, right. Doctor, the next question comes from Pooja, who asks, how can patients with weakened immunity systems protect themselves from opportunistic fungal infections, and what preventive measures are recommended for them?
See, if someone has a weaker immunity, then because वो कुछ भी हो सकता है, because maybe because of the medication she's on, whether she's on steroids or whether she's on immunosuppressive drugs. In that case, as any autoimmune disease, yeah, any for any immunity to build up your immunity, you have to be a proper diet. आपको 3 time properly meal, I told you, आपको properly 3 time meals लेना है. उसमें आप एक फर्दर सेट ऑफ टाइम अपना बना के रखें कि इसी टाइम पे मील लेना है, रात को उसी टाइम से सोना है, मॉर्निंग उसी टाइम से उठना है. डू सम काइंड ऑफ एक्सरसाइज इन द मॉर्निंग, योगा, मेडिटेशन. ठीक है, दीज आर होलिस्टिक अप्रोचेस which increase your immunity. Like, you have to keep yourself away from stress. This is very, very important, as I told you initially also, right? And जिंक हम लोग बोलते हैं, बिकॉज जनरली हम लोग बोलते हैं कि अगर आपकी इम्यूनिटी डाउन है तो आप जिंक सप्लीमेंट्स भी कुछ टाइम के लिए ले सकते हैं, बिकॉज जिंक टेंड्स टू इंक्रीज योर इम्यूनिटी आल्सो, राइट, फॉर सर्टेन इन्फेक्शंस। सो आप जिंक सप्लीमेंट्स भी बीच में यूज कर सकते हो, मल्टीविटामिन्स आप लोग बीच में ले सकते हो। लेकिन इन एनी केस, इफ यू आस्क मी हाउ यू कीप योर इम्यूनिटी गुड, you should follow your routine properly. Do some kind of exercise in the morning, yoga, meditation. These are the holistic approaches you can put in your life to be a good, to keep your immunity good. अदरवाइज जो मेडिसिन आपकी चल रही है, आप इम्यूनो कॉम्प्रोमाइज्ड हो या आपकी वोजिनल इन्फेक्शंस, वो आपको प्रिवेंट करने पड़ेंगे। यू हैव टू कीप योरसेल्फ फ्रॉम दीज इन्फेक्शंस। लेकिन यस, इम्यूनिटी का तो यही मैं बोलूंगा कि यू हैव टू कीप योरसेल्फ हाइड्रेटेड, a well balanced diet, and yoga and meditation. This is very, very important, right?
Right. Doctor, what about pet owners? क्या possibilities है कि animals से भी fungal infection human तक फैल सकती है?
See, it depends upon basically if you're keeping your pet healthy and आप उसको properly bathing और सब कुछ उसका hygiene maintain कर रहे हो, तो ऐसा नहीं होता। I have myself pet at my home. I've never ever suffered any skin infection with that pet. Okay, so it all depends upon you how you keep that pet. And there are certain infections which can cause from pet, which can cause infection of the pets also. But it's all about the personal hygiene of that pet and of yourself. So I've not seen any rise in the infection which is having pets at their home. So it all depends upon how you keep that pet healthy and sound. That all about I
Right.
can say. Yeah.
Right. Well, it was a very informative session today, Doctor. Before we take a leave, any take-home message for our viewers who has watched us so far?
So I just want to say that keep yourself healthy and keep your skin healthy by taking a proper आप एक तो अपना सेल्फ मेडिकेशन बिल्कुल ना करें। यू शुड नॉट सेल्फ medicate yourself. Keep yourself fit, healthy, है ना। आपका इम्यूनिटी, आपको जस्ट मेंटेन योर इम्यूनिटी इफ यू वांट टू गेट योरसेल्फ अवे फ्रॉम द इन्फेक्शंस। और दूसरा, डाइट, स्ट्रेस फ्री लाइफ, राइट, एंड डोंट गो फॉर एनी सेल्फ मेडिकेशंस, है ना, वो नहीं करना है। दैट्स द ओनली टेक होम मैसेज आई वांट टू गिव यू थ्रू दिस प्लेटफॉर्म। एंड इन्फेक्शन कुछ भी होता है, स्किन में कुछ भी हो रहा है, शो टू योर डर्मेटोलॉजिस्ट। डोंट गेट योरसेल्फ ट्रीटेड by someone else, right?
Well, I believe आप सभी को आज ये तो पता चल गया कि क्या नहीं करना है. Well, we had Dr. Jatin Sharma with us today, and thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers, and we look forward to many more such sessions in coming time. For our viewers, thank you so much for your excellent participation for today's session. And of course, do not forget to subscribe to our channel, Radiance with You. Thank you so much. You all stay safe and stay healthy.
Thank you. Bye-bye. See you.